Hi, I'm Dr. Aradia and welcome to My Doctor Told Me. Today, I want to talk about anxiety because anxiety is one of the most common mental health conditions in the UK and it affects a lot of people. I'm hoping to touch on what anxiety is, the symptoms of anxiety, and also think about some of the things we can do to manage anxiety. I hope you find this video useful. Firstly, what is anxiety? Well, anxiety is an emotion, like being angry or sad or happy. It forms part of our normal range of emotions and it has a place. But when we talk about anxiety as a mental health condition, what we're really referring to is when the symptoms are excessive and become a burden on the person and affects their ability to function normally in their day-to-day life. When we start to think about the symptoms of anxiety, I like to simplify things by focusing on physical symptoms and psychological symptoms. When we're talking about the physical symptoms of anxiety, what we're referring to is that stress response, that fight or flight response, where your body releases adrenaline, and this has actions all over your body. It causes you to be shaky, breathless, it raises your heart rate and can cause palpitations. It can even cause things like headaches and chest pain. When we think about the psychological symptoms of anxiety, these can be wide ranging, but really the hallmark is that the person has difficulty relaxing. They overthink and they over worry. They often have difficulty concentrating and always have like the fear of the worst thing happening. These symptoms can affect someone's ability to function at work, at home. It can affect their sleep. It can even affect their ability to eat. There are lots of other physical and psychological anxiety symptoms, and it presents differently in different people. So, the most important thing is that if you feel like you're having anxiety symptoms, reach out and speak to your GP. Now, I want to move on to talking about how we manage anxiety. When I talk to patients about managing anxiety, I like to simplify it by talking about using medicines or not using medicines. There's lots of lifestyle factors which have been shown in studies to be just as effective, if not more effective, than medicines for managing anxiety symptoms. The most important of this is exercise, but this also includes things like having a really good balanced diet and also having really good sleep hygiene. Talking therapies are one of the most important ways in which we manage anxiety symptoms. And talking therapies refers to anything from CBT, which is cognitive behavioral therapy, to other types of talking therapies such as counseling or therapy. Sometimes we do need to use medicines to manage anxiety symptoms. And that really depends on the individual, what their preference is, and also how severe the symptoms are. There's two main classes of medications that can be used to manage anxiety. The first class is called beta blockers. Beta blockers physically block the actions of adrenaline in the body. So when we talked about that physical response, the fight or flight response, beta blockers can be helpful in dampening down that physical response, but they don't have an action on mental health symptoms, on the psychological symptoms of anxiety. And so they're not really a long-term solution for managing anxiety, but they can sometimes be used to provide short-term relief. The other class of medications used to manage anxiety are the antidepressants. This is because anxiety and depression have a very large overlay in terms of the hormonal imbalance that is being treated with these medications. And these medications are designed to be used for anxiety. Which particular medication you use really depends on the individual, whatever other medical issues they may or may not have, and what works best for them. Thank you for listening. I hope you find this video useful. There's lots of resources out there to help people manage anxiety. But ultimately, if you're really struggling, you should reach out and speak to your doctor.